Hi everyone, hope you're having a happy Friday today. Happy New Year to everybody. I hope you had a really great holiday and was able to take some time to relax and celebrate. I know this week is, particularly difficult for most people getting back into work. Here in Ontario, where I live, in Toronto, we are in a lockdown, so pretty difficult week for a lot of people, and I wanted to come on here to actually talk a little bit about myself. I know there's been a lot of new additions to the group over the last few months, so I just wanted to come on here and share my story with you, my personal PCOS story, and talk a little bit about anxiety, because I've struggled with anxiety over the last decade or more, and so I wanted to give you a little bit about my experience and see what you guys also have to offer too. So first things first, every Friday around this time, around 9:30 a.m., I'm going to be coming in on live and speaking to you about any topic related to PCOS or even just in general. So please stay tuned, mark your calendars, put your notifications on in the group so that you can join and see a little bit about what I am talking about, or you can also tune in later. These videos are also going to be posted on YouTube, so if you ever want to watch all of them in the future, you can. And also these videos are in the album section of the group, so you can find them there as well. Okay, so let me tell you a little bit about my story when it comes to PCOS. I would say at a very young age, when I first got my period was pretty regular actually, and it was a little bit painful. I remember borrowing some of my mom's naproxen to help with the pain, and then periods were pretty regular for me at that time. I believe it's been such a long time that I can't even remember, but one of the biggest things that I experienced as a teenager was acne. And acne was really bad. I remember wearing MAC Studio Fix. I don't know if you guys know about this makeup, but it's a mix of powder and foundation, because it's so thick to help with just covering everything up. And so I ended up using that for many years and trying different things for acne. One thing I ended up doing is taking some medications. I think it was for about 5 years. I took antibiotics. It was oral antibiotics to help with, treating the acne, and it did help. But I found that it didn't do so well for my gut in later years. So, and I realized that after the fact. So I was taking tetracycline, I remember. And then, tetracycline was working on and off, and then I decided with my family doctor to try the birth control pill because that was the next option. And so I did. And I think at that point, that's when things kind of got a little bit triggered in my body. I ended up not feeling the best. I think it caused depression actually. And then I ended up going on antidepressants, and I was on it for a few years, and it didn't really do very much in terms of really changing my mood. But what I found at that point is my cycles became irregular after coming off the birth control pill. And, they would come every 32, 40 days. There was a few instances where I missed a month or two. I know when I wrote my board exams to become a naturopathic doctor, I missed 3 months of my period because I guess I was so stressed. But, at that time, I was focused on, my skin, but also really wanted to get regular cycles again. And I was so confused. I didn't really know what to do. My family doctor was helpful, but it was really a naturopathic doctor that actually helped me to get the diagnosis of PCOS, and then also treat it. So the other thing that I experienced was a lot of hirsutism, so excessive hair growth on my face, on my chest, on my abdomen, and so that was another telltale sign. I just thought it was normal, and that's just basically what I was given as in terms of genetics. But no, it actually, in fact, all came together around the age of 19, where I found out that I had PCOS, and now it's been many years. And around the same time, I was going to school I was going to school for science and business, so I was really interested in the science world. And so I started to pursue and think about, really trench myself into hormone health and really understanding what hormones mean for women and how it really impacts us on the day-to-day life. And so I ended up pursuing my master's degree in becoming a naturopathic doctor, and now I've dedicated my career to helping women with PCOS, to help them feel confident and empowered that they can manage this syndrome, as much as it can be very daunting and confusing. I really want to, my mission is to really help women feel confident that they can manage their PCOS on the day-to-day and feel okay with having this diagnosis. Because I feel like a lot of times, and I've gone through this as well, you almost feel like, why do I have this? Why do I have to experience this? It's so annoying. And, I know what it feels like to not get a period, and it doesn't feel good, and have all these physical signs and symptoms of high testosterone, like hair loss, excessive hair growth, and acne. So one of the biggest things that I've kind of experienced over the years is anxiety. And, a lot of you in the group have mentioned that anxiety is a big part of your case as well. And I have a lot of patients who talk about anxiety. So I wanted to talk a little bit about my experience with anxiety. One of the biggest things that I found that really impacted and caused the anxiety was having Candida. So this is excessive yeast in the gut. We have a normal amount of yeast in the gut, but what can happen is when there's more yeast in the gut, it can actually cause an imbalance between good and bad bacteria. And when that happens, we do find that it can cause symptoms of anxiety. It can cause many, many other symptoms as well, like bloating, vaginal, yeast, dandruff, brain fog, fatigue, so many symptoms. One of the biggest symptoms I found was anxiety. And balancing and treating my gut in terms of healing the gut, bringing more probiotics in, starving the yeast from sugar. So, sugar is a huge part of what yeast like to feed off of. So this is why I've created the 5-day sugar-free challenge. So if you're interested in that, I'll drop the link below. But yeah, I really worked on gut health at the very beginning, trying to really establish better microflora. And one of the biggest reasons why yeast was a big part of my case was because of that long-term use of antibiotics when treating the acne. And so first things first was treating that Candida. It also really helped my anxiety because now I was, producing or having more good bacteria in my gut. I was balancing blood sugar, which is a huge part of anxiety. Eating more protein, healthy fats, lots of good healthy vegetables, but really to stabilize blood sugar is that protein and fat, and that really helped to manage the anxiety. Actually felt much better. I find that when I eat more sugar, especially even now, I find that anxiety can get worse and can feel a little bit off from eating sugar as well. So if you're eating sugar and you feel like you're eating quite a bit, and this is not only just refined sugars like white sugar, this is also lots of carbohydrates. It can actually impact your mood. So that's one thing I really want you to take away from today. But then above and beyond that, some things that have really helped me for anxiety is meditation and yoga. So even just doing 15 minutes of yoga a day, I did like a challenge once, or a few times actually I've done it, and just doing 15 minutes a day for a month, my brain and my mind and my mood was much more balanced, less anxious throughout the day, and feeling more grounded for people around me. So Yoga Studio is the app that I commonly use, but recently I've been using Downward Dog and even just going to online classes to create that sense of community. So yoga is a really great one. We even have a study about yoga and reducing DHEAS. This is a type of testosterone that comes from the adrenal glands that is where cortisol actually is produced as well. So the more stress we have, sometimes we produce more DHEAS. So this type of testosterone can also impact symptoms of, the physical symptoms I talked about: hair loss, acne, excessive hair growth. So definitely working on and looking at lab work to see what's going on. But that study said it was yoga, mindful yoga 3 times a week, and I think it was for 8 weeks, and what they found was DHEAS levels came down, and anxiety was much better. So really focusing your attention on things that can calm the nervous system down, deep breathing, taking breaks, listening to music, talking to friends, whatever it is that really helps calm your nervous system down, really focus in on those things, and then look in to see if maybe you do have some of the symptoms of Candida, or you're eating quite a bit of sugar, and see if you can manage and balance that, because that can really, really help symptoms of anxiety, which I know a lot of people are feeling that way, especially here it's winter, so depending on where you are, maybe you're in a sunny state or city, and this doesn't necessarily apply to you. But if you aren't and you're here in the winter months with me, definitely take more action onto this, and also get your vitamin D tested, because that can really, really impact mood if vitamin D levels are low, and we do know vitamin D can be low in women with PCOS. So I hope this was helpful. I'm gonna actually post a few polls today on the group. Please try to participate in the polls so I can see how I can help you this year. Answer your questions, and be more specific on topics that you really want to learn about. So Happy New Year again, happy Friday, and if you have any questions at all, pop them into the group, and I will be there supporting you along the way. Take care, everyone.